There is a lot of demand nowadays for creating a dimple in the cheek. A dimple in one cheek or dimples in both the cheeks. It is an interesting proposition for people feel that your dimple, that you smile, makes you look more attractive, more appealing and improves your looks. It is true that a dimple looks nice on the face, but creating a dimple is not a very easy job. It needs good surgical skill to create a dimple, and you should always go to a good cosmetic surgeon or at least a good plastic surgeon to get a dimple made, for something not done correctly can have bad consequences. I do dimple creation almost always under local anesthesia. Give you some injection, make the area numb, you know what's going on, do the procedure which takes about an hour and a half, 2 hours, and you go home immediately after the procedure. Of course, if a person is getting some other operation done under general anesthesia and wants the dimple to be created at the same time, it also can be done under general anesthesia as the other procedure demands. What you basically do in a dimple is to create a gap in the muscle of the cheek on either side between the skin and the mucous membrane. So the skin and the mucous membrane adhere together, there is no muscle, and when the patient smiles, the absence of muscle in that zone creates that depression or dimple. There are landmarks for a dimple. For a dimple normally should be a couple of centimeters away from the angle of the mouth and in line with the eyeball, but the patient can choose its own site as well. To create a dimple under local anesthesia, you open the mouth, get to that point, core amount of muscle out of it, and then stitch the mucous membrane to the dermis, which is the deeper layer of the skin, to have an adhesion so that the tissue remains adhered there, the muscle still does not unite and has a gap, and a dimple is created. It sounds very easy, but it's not that easy. For doing it inside the mouth at an angle can be a tough job at times. When a dimple is newly created, it doesn't look nice because the dimple is there all the time. So initially for 2 to 3 weeks the patient is unhappy. The patient must be told that it will take about 4 weeks to settle down, and the patient might think, I don't like this and get back, doctor, please remove the dimple, I don't want it. But you need to have some patience, wait and watch, and slowly that dimple matures and gives you that beautiful depression whenever you smile. I have done good number of dimple creations, technically difficult, but if done properly, excellent results. And if you want your smile to look a little different, with that depression on your cheek, make you more attractive, come visit us, consult us, and we'll help you get your choiceful dimple.